Hello everybody, my name's Ty. I'm having the gastric sleeve. Some of you may heard of it, called the vertical sleeve gastrectomy, or VSG for short. During the decision process for myself and my family, we've logged a lot of YouTube hours. There's lots of you out there who have already made videos on the lap band, the gastric sleeve, the gastric bypass, and for all of you, I can't thank you enough. You guys have provided tons of information, so me making this video for myself as a log and a diary, so to speak, to track my progress. I'll be posting them up on YouTube to hopefully give back to the community in some way. Maybe there's someone out there who will gain something from watching my experience. I'll go ahead and give the stats first, so that way it's quick and easy and fairly painless. So if you don't want to watch the rest of the video, you don't have to. You can just hear basically where I started and where I'm at so far. My highest weight, 333 pounds. When I started seeing my surgeon, 327 pounds, and that was 8 weeks ago. And currently this morning I weighed in 2 days before surgery at 283.4 pounds. So that's a total weight loss of 43.6 pounds. So I'm very excited about that progress. So a little backstory about myself, which I'm sure most of you can relate to who are watching this, or some of you anyways. I've been overweight my whole life. I've always dealt with being overweight. I've lost a lot of weight and then gained it back. And usually when I gain it back, I gain back more than I lost. Again, a game that you all can probably relate to. I've tried many different ways to lose weight, whether it's a quote-unquote lifestyle change, whether it's a diet, a modification, whatever you want to call it. We've all done it. We've tried it. Things have worked, and then I've always kind of fallen off the wagon, so to speak, and gained that weight back. I've done the Body for Life. I lost 62 pounds in just under 3 months on the Body for Life. That was fantastic, but some things got in the way, and I didn't stay on that diet. I did the Body for Life again just a few years ago and lost like 47 pounds. Gained back the weight and then some. I've done the Weight Watchers point counting. I've done my own little counting, and I've always gained the weight back. So I'm 5'7", and again, like I said before, my highest weight is 333 pounds. Being 333 pounds caused some problems for me medically, which unfortunately, medical issues are probably some things that make a lot of people make life-changing decisions, and unfortunately it took that to happen for me to really realize that I need to make a change for myself. Type 2 diabetes and hypertension are obviously nothing to joke about or mess with. It's a pain in the ass. It causes problems. So at least, looking positively, those helped me make my decision to do what I'm doing. When I started seeing my surgeon about 8 weeks ago, he gave me a weight loss goal of 20 pounds. In order to have the surgery, most surgeons will give you a weight loss goal to help shrink your liver. In order to do the surgery laparoscopically or robotically, when they go in, they have to lift the liver out of the way to do the actual procedure on your stomach. Lifting the liver can cause a problem if the liver is too heavy or too fatty. It can rip or tear, which would cause bleeding internally and cause you to go in a direction that you don't want to go. So 20 pounds was my weight loss goal. When he gave me that 20-pound weight loss goal, he also suggested that I download the app MyFitnessPal, and also do a 12 to 1500 calorie diet using the MyFitnessPal. Now, I know I'm not the first person to use MyFitnessPal. I know I didn't discover it, I didn't make it, and I know I'm not the last person, but the point of that is that if you have the ability to download it on your smartphone, iPhone, Android, doesn't matter, download the app. It's a fantastic app that helps you stay accountable for what you're putting in your body. Accountability is key, and it does its job. At least it did for me. You'll learn shortly using that app, and again, with that app, you can eat whatever you want. The issue is that you have to account for each of the calories you're putting in your body. So fairly quickly, you'll learn what tastes good, what has a lower calorie count, and what's going to benefit you the most. I mean, the lower the calorie count, but the better tasting something is, the more you can have, which gets you further throughout the day. It makes you feel like it's not as much of a struggle. It's going to kind of keep things easy going for you. Prior to surgery, 2 weeks prior to surgery, I had to be on a liquids-only diet. I knew that was coming, so while using the 1500 calorie diet using MyFitnessPal app, I decided to go ahead and make a little modification, which was 2 weeks out from the 2 weeks prior to surgery, if that's not confusing. For 1 week, I replaced my breakfast with a protein shake. And then the second week of this modification, I did breakfast and lunch replaced with a protein shake and only eating dinner. That way I gradually eased into the liquids only diet and it wasn't so drastic. I do think that helped. Doing the MyFitnessPal 1500 calorie diet and the modification with the replacement meals, I was able to lose just over 33 pounds. And then with this liquid only diet, as I said, I'm only 2 days away from surgery, I was able to lose a little over 10 more pounds. So again, to recap, 333 pounds highest weight, 327 starting with the surgeon. Given a weight loss goal of 20, I've lost 43.6 pounds to where I weighed in this morning at 283.4 pounds. So again, I'm excited. I know I repeated myself, but I'm excited about that. So I'm moving in the right direction, and I'm excited to see where it goes. I'll do my best to keep up with this video, or with the videos, and post more of them. I'm going to make a video in just a moment here, more in depth about the 2-week liquid diet and some of the supplements that I used or didn't use, and to give you a little insight on how awesome that was. I know everybody's looking forward to a 2-week liquid diet. So again, for all of you that have already made videos, thank you so much for all your help getting me here, and for all of you who are watching my video, thank you very much for watching, and I hope that my information will at least give you a little insight to my experience, a male's point of view. There weren't a lot of males' perspectives on YouTube. There were some, but not a lot. So, this is for the men, the women, doesn't matter, but I just want to at least give a male's perspective on this gastric sleeve. So thank you very much for watching, guys. I appreciate it, and I will check in with you guys soon. Thank you.